My name's Grant Booher. I'm a neurosurgeon in Fort Worth, Texas. So I'm the owner and founder of Longhorn Brain and Spine, and I've been practicing here for 3 years now. When I started at the University of Texas, my grandfather was diagnosed with Alzheimer's. And so that really drove my passion to study neuroscience, and I majored in neurobiology at University of Texas. Growing up, I was always real hands-on. My grandfather was actually a carpenter. I loved working with him and building things and just using my hands. So when I started medical school, I knew I wanted to do something more hands-on where I could physically help somebody. So that naturally led me to surgery and my interest with neuroscience. My favorite part of being a surgeon is obviously being in the operating room. You know, that's kind of my zen place. Everything kind of slows down for me. Just being able to physically see the anatomy, work on a patient, and know that I'm changing their lives. That's what I love about being a surgeon. The unique thing about my practice, Longhorn Brain and Spine, is that I am a solo neurosurgeon. I'm not affiliated with any of the big healthcare systems in town. Not that there's anything bad about that, but I really value independence. There's not a better feeling than coming to my clinic and seeing a patient who's been seeing me for the last 3 or 4 months, you know, just kind of working them up and sending them to certain treatments, and then eventually I end up operating on them. And then they come back and they say, my life has just totally changed. I feel 100% better. I haven't felt this good in years. That is hands down the best part of my day. A patient knows that they need a neurosurgeon. That varies widely. You know, a lot of the times patients will take the path of they've seen their family doctor, they've seen a pain management doctor, they've done physical therapy, and they almost just feel like there's no hope because they've gone through X, Y, and Z treatments and their pain is just so severe and they feel like there's nothing that can be done. It's important for patients to talk to a patient partner mentor because this is one of the scariest situations that you could be in your life. If you're going to see a neurosurgeon for spine surgery, it's a lonely feeling. No one can relate to what these patients are going through, the amount of pain that they're having, the amount of anxiety that they're feeling surrounding surgery. So it can feel very lonely. So to have somebody who's been there, done that, recovered, and is now on that back end, kind of looking back at the whole experience, I mean, that in itself is just invaluable.